Hi, I'm Anthony Carey with Function First in San Diego, and welcome to another edition of our corrective exercises from the pain-free program, the book, The Pain-Free Program, A Proven Method to Relieve Back, Neck, and Shoulder and Joint Pain. With me I have Wendy Cole, one of our corrective exercise specialists here at Function First, and Wendy's going to help me demonstrate this exercise. This is a non-technical explanation for the ankle squeezes in the sway back pose. We have a very technical version for the health professional that's in my DVD, Corrective Exercises for Powerful Change 2. This version is to help those that are doing the exercises at home or through the book to get a better understanding or a reminder of how to do it properly. So the way we're going to have Wendy start out is actually on her hands and knees, and we position the wrists directly under the shoulders with the elbows straight. In this case, Wendy's hip is just above her knee joint. And what we want to do typically is we're going to have the client walk the fingers out about 4 to 6 inches, still move the shoulders directly over the wrist, but now what that does is that puts the hip just a little bit in front of the knee, so the thigh bone's on a little bit of an angle. What we ask of the client here is just to completely relax the abdominals. The weight of the internal organs will cause your back to kind of drop and sway a little bit. That's what we're expecting to have happen. We really want to keep the elbows straight, which allows the shoulder blades to relax together. And this secondary or passive extension in your upper back actually contributes to some more relaxation into the lower back. This position in and of itself can be very comfortable for a lot of people. You'll see Wendy's also completely relaxed her head down, which lets the shoulders and the upper traps relax too. So this exercise, this position, kind of decompresses the body up through the upper trapezius and even into the lower back. Now, one of the modifications that we can make for this exercise is some people, if they move their hip forward a little too, or the hip forward of the knee a little too much, it can create a little bit of stress in the lower back that they're not comfortable with. We can modify that by just bringing the hips back to where they were, and then we can move the hands back as well. That will change a little bit of where you feel it in your lower back. A second modification that we can make for some people is that they have a hard time keeping their elbows straight, or they even might have a little bit of discomfort in their hands and wrists, depending on what's going on. So we can modify this by having Wendy drop down to her elbows and her forearms. Now in this position, it basically takes the elbow, or takes the wrist out of it, and now the elbow is resting on the floor with the forearms. We'll still remind you to kind of really relax and drop through here, and then let the head go down, and we get the same response through here in the back. Just a little bit less stressful on the shoulders and the upper back. So we're going to have Wendy get back up into the original position on her hands and knees. What we're going to really want to have happen here is these muscles in your lower back will actually relax and get soft here. Even if your lower back feels tight and they're shortening in this position, they're shortening in a relaxed position. They're not forced to contract to do that. So this should cause, what we're really looking for is for these muscles to kind of get soft and relax in this position. Then what we're going to do is, here we use our little 6-inch blocks, which we have available on our website, and I'm going to take this, I'm going to put it between Wendy's ankles. And it's going to go right between the ankles and kind of cover the whole border, inside border of her foot, not going all the way up to her knees or even up into her calves, because we want to keep that squeezing part happening at the longest part of the foot. And we might have Wendy cheat her knees apart just a little bit. So the average person, we want the knees about 6 to 8 inches apart. So everything's nice and relaxed here like we asked Wendy to do. And then what we're going to have her do is gently squeeze and release the pillow. When we have people squeeze, a reminder is that it's only about 60% of your maximum effort. You'll notice that Wendy's just squeezing nice and easy. So whatever you think your hardest is, just a little bit more than half of that as she squeezes and releases. Now the activity from that squeezing is not happening at her foot and ankle. It should be happening around her hips and her lower back. Very subtle contractions that are making the muscles tight and relaxed. This really helps with the positioning and symmetry of the muscles in your lower back and even into the buttocks. So as we squeeze and release here, the idea is not to bring the muscles to fatigue. We will often have people do maybe 3 sets of 10 and stay in the position in between the sets. But if necessary, if somebody needed to rest their upper body, we would allow them to come out of the position temporarily and then go back to the squeezing or go back down to the elbows. But this is a great position, kind of puts the spine in the opposite of what you're doing when you're sitting all day. These are the ankle squeezes in the sway back pose, part of the pain-free program. Thanks for watching. www.functionfirst.com. Take care.